A delusion is a psychotic disorder where an individual has a fixed belief in an incorrect perception of reality. The most common delusions are persecutory delusions, grandiose delusions, jealous delusions, erotomanic delusions, somatic delusions, mixed delusions, and unspecified delusions. The risk of delusional disorder in the general population is estimated between 0.05% to 0.1% and affects individuals from the age of 18 years to 90 years. The persecutory and jealous delusions are common in males, while the erotomanic delusions are more common in females. 1. Persecutory delusions. A persecutory delusion or paranoia delusion is a fixed belief of being persecuted, potentially harmed, or conspired against, resulting in emotional and behavioral actions that can be extreme. 2. Grandiose delusions. A grandiose delusion is a fixed belief of being famous or having prominence, talent, and great achievements. It is also known as megalomania. 3. Jealous delusions. A jealous delusion or Othello syndrome is a fixed belief of being betrayed by the partner, such as being unfaithful, and having evidence to support the delusion. This type of delusion can lead to extreme violence such as suicide and homicide. 4. Erotomanic delusions. An erotomanic delusion is a fixed belief of being secretly loved by an individual who may be known or famous and outside the circle of the delusional individual. This type of delusion is associated with intense expressions of love that can lead to stalking and assaultive behavior. 5. Somatic delusions. A somatic delusion is a fixed belief of individuals in having something wrong with their bodies, such as having an ugly body, an unknown disease, or being infected with parasites and insects, leading them to visit many doctors to determine their delusional illness. 6. Mixed delusions. A mixed delusion is when the affected individual has a combination of several types of delusions. 7. Unspecified delusions. This type of delusion cannot be classified according to the different types of delusions. Now that we discussed the different types of delusions, let's talk about the medical conditions that can cause delusions. Although the mechanisms are not known, several biological causes that may contribute to the development of a delusional disorder. 1. Head injury may affect regions in the brain resulting in delusions. 2. Seizures such as the ones associated with temporal lobe disease. 3. Dementia. Delusions in dementia patients typically results from their cognitive impairment. 4. Basal ganglia disorder. This rare disease affects the brain and other parts of the nervous system and can lead to delusions. 5. Unbalance in neurotransmission due to anomalies in the function of tyrosine hydroxylase involved in the synthesis of dopamine, epinephrine, and norepinephrine. In addition to biological causes, other causes such as genetic factors, environmental factors, and psychological conditions can cause delusions. Delusions appear to be more common in individuals with family members diagnosed with a delusion disorder or paranoid personality characteristics. Stress, drug and alcohol abuse, and individual social isolation, such as immigrants, appear to be contributing factors of delusions. Although delusions have fewer symptoms and functional disability, they have been classified on the same spectrum as schizophrenia, and therefore, the neuropsychological models that are applied to schizophrenia are also applied to delusions. But how are delusions treated? The treatment of delusions may involve pharmacotherapy, cognitive behavioral therapy, psychosocial interventions, and supportive psychotherapy. However, building a good doctor-patient relationship is the key to the success of the treatment. Pharmacotherapy involves the use of psychotic medications, and antidepressants are used for somatic delusions. Cognitive behavioral therapy, or CBT, focuses on identifying biases, worries, interpersonal sensitivity, reasoning style, and any factor that may have influenced the formation of the delusion, known as ideation, and what the delusional individual consider as evidence for the delusion. The discussion and analysis that are performed during CBT can help deconstruct the ideation that is at the heart of the delusional disorder. Supportive therapy aims at reducing the discomfort of the delusional individual through gaining insights about the individual experiences with the delusion and providing suggestions. This therapeutic approach can also help the acceptance of the treatment process through educating the delusional individual about the illness. In conclusion, psychotic disorders are associated with individuals that have different perceptions of reality than those of most people around them. Delusions are also psychotic disorders characterized by a fixed and non-changeable interpretation of the reality which other people around them do not perceive. The delusion is also a process that relies on building fixed ideas and concepts which explain the difficulty in treating delusional individuals. Therefore, achieving a successful treatment of a particular delusion would involve deconstructing those exact same ideas and concepts that make the delusion. However, building a good doctor-patient relationship is the key to the success of the treatment. If you enjoyed the video, please like, subscribe and share for more videos like this.